All right, guys, welcome to our patient assessment. So this is our wonderful patient here. If we did a full top-down assessment, where I usually start is I'll start with just kind of evaluating the wrinkles, kind of those fine lines. So I'll say, raise your eyebrows, and we can see just these very fine wrinkles there, okay? Make a mean face. You can see them there. Now squint your eyes. We can see them all right there. So she's a great candidate for tox. So we're gonna do some Daxify on her forehead, her glabellar lines or the 11s, and her crow's feet. In addition to that, she's a fantastic candidate for mid-face filler. So you can see she's got quite a bit of mid-face volume loss right in here in the cheeks. So what I like to do is I like to kind of, the fat pads drop as we age. So I like to just displace them back up. So I'll show the patients, I'll go, this is kind of my goal, is restoring the volume into the cheeks, and that'll help with these deep lines underneath the eyes. So I'll hand you a mirror and I'll kind of show you that too, right? So you can see if I just do that and put a little more volume there, it's going to look a lot more youthful and restore the volume that belongs in the cheek. As we age, the fat goes from being up here, because if you've ever seen a baby, let's take it all the way back. What do they have?
Little
chubby cheeks. Exactly. That carries on through our teens and our 20s, then into our 30s and 40s. Those chubby cheeks start dropping. We lose weight. The fat pads go down. So we lose all that volume. And what's really happening, which accentuates that nasojugal groove or the tear trough, is that the fat is descending as well. It also descends in here. You're very lucky. Yours hasn't done that yet. But the fat that's in the cheeks will descend down here, and that's what causes the jowling. And that all happens over time. Now, where you're at, we can still treat that with soft tissue fillers like RHA. So we still have that option. When I see a patient who's in their late 60s and 70s and everything's down, at some point we have to just lift, right?
Yes.
But thankfully for you, and good thing in your case, is we can still use RHA fillers to fill in the volume.
Awesome.
Okay, so what I'm going to do is I'm going to use a more structural filler for the cheek area. So I'm going to use something like RHA 4 for your cheeks, and then something a little softer like a Redensity or a 1, but probably Redensity to fill in the tear trough. So something nice and smooth and light.
All right.
And that should do wonders for restoring a youthful look of the mid face and the lower eye.
Okay.
Let's do it.
Let's do it.